Hi, I'm Shirley Gutkowski, and we are going to start polishing. I have already checked my patient's health history out. We know that she does not have a respiratory infection. We know she isn't on a sodium-restricted diet. We know that she does not have a lot of fancy crown and bridge to worry about the different powders, and we are safe to go right ahead with the sodium bicarbonate. Now, the next thing that I'll be doing is putting in the suction. I'll be using the saliva ejector, as we've already seen how I bent it. I really like this tip best. I like the softer angle. So my patient is ready. The saliva ejector is in her mouth. I've cautioned her to just relax her face and relax her tongue. And I'm going to start then on the lower lingual, on the teeth furthest from me. I'm going to put the mirror in to protect her tongue from the spray. And I'm going to ask her to open wide. And I'm going to start spraying. So once we get back here, I'm not going to activate the polisher because I want you to be able to see what it is that we're doing. As we're moving forward, I'm going to polish a couple of teeth like that. I'm going to go back and forth a little bit. I'm going to point a little bit towards the gingiva, apical to the crown of the tooth. And then I'm going to stop at about 3 or 4 teeth. I'm going to lift my foot up and I'm going to rinse that section. I'm going to remind my patient to turn towards me so whatever saliva starts to accumulate and the water from the tip runs down into the saliva ejector right there. Then I'm going to continue moving on and I'm going to polish the lower anterior teeth, just angling however I need to achieve the polishing. And I want you to take special attention or pay special attention to the mirror. The mirror is protecting the teeth from the spray. It doesn't really hurt, but patients do say that it feels kind of prickly. So now I'm going to continue polishing here like this. I'm going to move my hand. The cord, I want to also make special note of the cord, how light that cord is and how it's so easy to manage. That was a real positive benefit from what I was experiencing. Then as I go around this way, I'm going to protect the lip a little bit. Sometimes the spray goes more forward, sometimes the spray goes more towards the tongue. So depending on the patient and depending on what it is that you're after and how comfortable the patient needs to be, you're going to move the mirror to protect the lower lip. So as we go around, I'm going to continue to polish 2 or 3 teeth. I'm going to continue to protect the tissue that's the most sensitive. And I'm going to polish 3 or 4 teeth and then rinse and then polish 3 or 4 teeth. When I'm done with the entire arch, the lingual of the entire arch, I'm going to just rinse the tongue to get the powder off if there's any still left on there. And then I'm going to move around to the lower facial. I'm going to hold this cheek back and you can see that the saliva ejector is still pretty free. You'll notice too that my mirror right now isn't really fulcrum anywhere. I will let you in on a little secret because it's kind of out of the shot of the picture here. I'm fulcruming my elbow against my waist. That's how I'm keeping everything steady. So as I'm polishing now, I'm fulcruming with my little finger on my patient's chin and I'm just going to polish 3 or 4 teeth just like that. And then I'm going to move my foot and we'll be able to just press the foot pedal down again and have just plain water and rinse these 4 teeth that I just did. Then I'm going to move to the lower anterior and I'm going to polish the teeth here, protecting this lower lip right here. You can see where I'm fulcruming is under the chin with my little finger again. I'm going to polish and rinse, polish and rinse. So then, after I'm done with the entire lower arch, I'll give her one more rinse with the handpiece, and I'll move to the upper arch.